Jared Polis ran for governor, promising to reduce the cost of health care. We are still too cheap to get the jingle voice, leaving me to tell you that one of Polis's promises was debated at the Capitol today. Here is that promise from the State of the State.
A reinsurance program for the highest cost cases is a proven solution to reduce health care costs. It's worked in other states. It's one we should embrace in Colorado to save small businesses and individuals money.
Did I know what reinsurance meant this morning? I did not. It essentially is providing insurance for insurance companies. You're thinking, how does that save me money? I'm not an insurance company. No, you're not. But politics guy Marshall Zellinger explains.
Here's how reinsurance in Colorado would work. Instead of insurance companies and consumers paying a medical provider for coverage of a high claim, a state fund would be created with federal dollars to help insurance companies pay for those high claims on the belief that insurance companies would lower the cost of premiums for the consumer. At the same time, the state would limit how much the medical provider would be allowed to be reimbursed for the medical services.
By taking those more expensive medical claims out of the pool, we're able to lower the risk for all of the other lives and bring down insurance premiums.
State Representative Julie McCluskey is sponsoring the bill that Governor Jared Polis believes will fulfill a Polis promise and lower insurance and health costs.
I don't think I met a single person anywhere in the state in my campaign for governor that said I'm paying too little on health care.
Unfortunately, the bill as currently drafted puts the whole cost of this on hospitals, and we don't think that hospitals should be the only ones to bear the burden of this program.
The Colorado Health Association is against the reinsurance bill, at least as it reads today, because there's no guarantee insurance companies will lower your premium, despite hospitals receiving less.
Payments to hospitals and other healthcare providers, doctors, nurses, physical therapists, and others will be cut without any of our direct costs also going down.
Addressing how much each healthcare service actually costs, that's for another bill. This one deals with how those services will get paid.
We are bringing down how we are paying for the services that are delivered by our providers and by our hospitals.
A few notes. This could save money for people who buy insurance off the exchange, people who buy it on their own, not through an employer plan. And where would the federal money come from? That's a little complicated, but if you're lower income, there's a federal tax credit you receive to help you pay your premium. But if this bill works and your insurance premium becomes cheaper, the money from that tax credit will instead go to the state and then filter to the insurance companies, Kyle.
You know, Marshall, they say that we should not tackle complex topics on the TV news because people don't like that.
My head hurts, but I thought in that first 20 seconds you might have grasped it.
You should know it. It's important stuff. And if the end goal works and it saves people some money, there you go. All right. Thank you, Marshall.
Subscribe to the Next YouTube channel for the best of Next and some other stuff.